Chapter 2, The Human Body in Health and Disease. Now, I'm not going to record every PowerPoint in this course. However, I am choosing to record chapters 1, 2, and chapter 15. These are the kind of the building blocks to a lot of the terminologies that you're going to be using. The remaining chapters are going to be devoted more to specific body parts or body systems. So those PowerPoints are going to just be listed, and you can go in and read those for yourself. They will be a little bit longer, but there's not going to be very many notes on those. So the anatomical reference system is going to be used to describe the locations of structural units of the body. When we're talking anatomical reference system, this is going to include the body planes, the body directions, the body cavities, and the structural units. When the body parts work together, they perform a related function, and then they're grouped together and known as a body system. When we talk about anatomy, we're studying the structures of the body. Anatomical means referring to anatomy. Physiology is going to be the study of the functions of the structures of the body. Physi means nature or physical, and ology, once again, means the study of. The anatomical position will describe the body standing in the standard position. And if you look at the picture in your slide, that is the standard position. The client is standing up straight, so the body is erect and facing forward, holding the arms at the sides with the hands turned so that the palms face toward the front. So when we're talking about different anatomical positions, picture this in your mind. The body planes are imaginary vertical and horizontal lines that are used to divide the body into sections for better descriptive purposes. They're aligned to the body standing in the anatomical position. The vertical planes include the sagittal. This is a vertical plane that divides the body into unequal left and right portions. The mid-sagittal or midline sagittal plane divides the body into equal left and right halves. The frontal or coronal vertical plane divides the body into anterior, which is the front, and posterior, which is the back. We know post is always after, so if you think of the front as being before and the back as being after, then hopefully that will help you remember which is anterior and which is posterior. We look at the horizontal plane. The horizontal plane consists of the transverse plane, which divides the body into superior, which is going to be the upper portion of the body, and inferior, which is the lower portion. So anything that is above will be superior, anything that is below will be inferior. Then we look at the body direction terms. This is a relative location of different sections of the body or of an organ. And it's described through the use of pairs of contrasting body direction terms. For example, we have ventral, which is opposite of dorsal, so it will refer to the front or the belly side. Dorsal being the opposite of ventral, will refer to the back of the organ or the body. We're talking about cephalic. This is opposite of caudal. Cephalic means toward the head. Caudal, being the opposite of cephalic, will be the opposite. So it means toward the lower part of the body. And we've already discussed anterior being the opposite of posterior. So anterior is situated in the front and posterior is situated in the back. So again, example, superior, opposite of inferior, means the uppermost. It's above or it's toward the head. And inferior means the lowermost portion or below or toward the feet. Proximal is opposite of distal. Proximal means situated nearest the midline or the beginning of a body structure. So we're drawing that line right down the middle of the body. Anything that is closer to that line going down the middle of the body is going to be proximal. Anything that's further away will be distal. Medial also can be more towards the midline. It is the opposite of lateral, so anything that is closer to that line, that imaginary line down the center of the body, lateral would be opposite, so it's going to be the furthest distance away. So, for example, if we're talking about the abdomen, the umbilicus or the belly button is going to be medial, but the hips would be lateral. Now let's talk about body cavities. We do have two major body cavities. Once again, the dorsal and the ventral, so the back and the front. We have spaces within the body that will contain and protect internal organs. The dorsal cavity is located along the back of the body and the head and contains organs of the nervous system and coordinates body functions. It is divided into two portions: the cranial cavity, which is located within the skull and surrounds and protects the brain, and the spinal cavity, which is located within the spinal column and surrounds and protects the spinal cord. Other major body cavities, we have the ventral cavity, located along the front of the body and contains organs that sustain homeostasis. Stasis means we're keeping the status quo. Everything is kind of staying the same. And it is also going to be divided into portions. We have the thoracic cavity, which is also known as the chest cavity or the thorax. We have the diaphragm, which is a muscle that is going to separate the thoracic and the abdominal cavities. The abdominal cavity will contain the major organs of digestions. And then we have the pelvic cavity, which is a space that's formed by the hip bones and contains the organs of the reproductive and excretory systems. Or the abdominopelvic cavity refers to the abdominal and pelvic cavities as a single unit. We also have inguinal, which refers to the entire lower area of the abdomen and includes the groin. Regions of the thorax and the abdomen will divide the abdomen and the lower portion of the thorax into 9 parts. And if you look at the picture that is third from the left or second from the right, you can see that we have the right and left hypochondriac regions, covered by the lower ribs, the epigastric region, which is located above the stomach, the right and left lumbar regions, which are located near the inward curve of the spine, the umbilical region, which surrounds the umbilicus, commonly known as the belly button or the navel. We have the right and left iliac regions, which are located near the hip bones. And then we have the hypogastric region, which is located below the stomach. When we are assessing the abdomen, we often will divide this into quadrants, which will describe where an abdominal organ or pain is located. So to develop those quadrants, which means 4, we have an imaginary line drawn vertically and horizontally through the umbilicus. So that will provide us with the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. When we talk about the peritoneum, excuse me, we have the parietal peritoneum, which is the outer layer of the peritoneum that lines the interior of the abdominal wall, and parietal means cavity wall. We also have the mesentery, which is a fused double layer of the parietal peritoneum, and it attaches parts of the intestine to the interior abdominal wall. We have visceral peritoneum, which is going to be the inner layer of the peritoneum that actually surrounds the organs of the abdominal cavity. Visceral means relating to those internal organs. Retroperitoneal means located behind the peritoneum. If we have the word peritonitis, remember itis is telling us we have an inflammation. So this indicates inflammation of the peritoneum. The body is going to be made up of increasingly larger and more complex structural units. From the smallest to the largest, we've got cells, tissues, organs, and body systems. And as they work together, these structures will form the complete body and enable it to function properly. Cells are going to be specialized and grouped together to form tissues and organs. Cytology is going to be the study of the anatomy and physiology, pathology, and chemistry of cells. So a cytologist is going to be the person or the specialist in the study and analysis of cells. So let's talk about a few of these cells. Stem cells are going to be unspecialized cells. They're able to renew themselves for long periods of time by cell division, and under certain conditions can be transformed into cells that have special functions. The adult stem cell is normally going to have the primary role of maintaining and repairing the tissues, compared to the embryonic, meaning this is going to be the embryo, or that's what we call a fetus or a baby, as it is just forming. Those embryonic stem cells have the ability to form any adult cells. So once again, embryonic is referring to the embryo, which is going to be that developing fetus during the first 8 weeks in the womb. These embryonic cells can proliferate. They grow very rapidly, and they can do that indefinitely in a lab. So they could potentially provide a source for adult muscle, liver, bone, or blood cells. They are more primitive than the adult stem cells, and embryonic stem cell transplants don't require as perfect a match between the patient and the donor as when we transplant adult stem cells. These embryonic stem cells come from cord blood that's found in the umbilical cord and the placenta of a newborn infant. They can be harvested at the time of birth without danger to the mother or the child, and can also be obtained from surplus embryos produced by in vitro, or those test tube fertilization babies. Stem cell therapy is also known as regenerative medicine, and it has a lot of potential uses to heal injuries and treat diseases. So cells for this purpose are usually going to be harvested from the hematopoietic, or blood-forming tissue of the bone marrow. It can be harvested from the patient's own bone marrow or transplanted from one individual to another. Unless there is an excellent match between the donor and the recipient, there is the possibility of rejection, and we term that graft versus host disease. With genetics, we have dominant and recessive genes. Every individual is going to receive 2 genes of each genetic trait. They'll get one from the mother and one from the father. The dominant gene can be inherited from either parent. Offspring will inherit that genetic condition or characteristic. Dominant gene examples would include freckles, which is a physical trait, or Huntington's disease, which would be a hereditary disease. The same recessive gene would be inherited from both parents. And when that happens, offspring will have that condition. This would be an example of sickle cell anemia or inherited red blood cell disorders. A recessive gene that comes from one parent and you get a normal gene from the other parent, offspring will not have that condition. The human genome is going to be a complete set of genetic information of an organism. We have chromosomes. A chromosome is a genetic structure that's located within the nucleus of each cell, and chromosomes are made up of DNA molecules that contain the body's genes. A somatic cell is going to be any cell in the body except the gametes, which are the sex cells. And it contains 46 chromosomes that are arranged in 23 pairs. 22 identical pairs of chromosomes plus another pair. The remaining pair is going to be XX for a typical female and XY for a typical male. A gamete, which is a sperm or an egg, is also known as a sex cell. And only one type of cell it is the only type of cell that does not contain 46 chromosomes. Each ovum or egg or sperm has 23 single chromosomes. Newly formed offspring will receive 23 chromosomes from each parent for a total of 46. The X or Y chromosome from the father will determine the gender or the sex of the child. Human DNA contains thousands of genes and provides information that's essential for heredity, determining our physical appearance, our disease risks, and other traits. DNA is an abbreviation for deoxyribonucleic acid, which are the main component of chromosomes. They're the material that carries the body's genetic information. And it's found in all types of cell except erythrocytes. Remember, erythro is going to be red, and the cytes are going to indicate the cells, so the red blood cells. DNA is packaged in a chromosome, so we have two spiraling strands that twist together to form a double helix. No two DNA patterns are exactly the same, except in the case of identical twins. A very small sample of DNA can be used to identify individuals for criminal investigations, paternity suits, or genealogical research. Now, a genetic mutation is a change of the sequence of the DNA molecule. We can have a somatic cell mutation, which is a change within the cells of the body, and they affect the individual but cannot be transmitted to the next generation. But if we have a gametic cell mutation, which is a change within the genes in a gamete or that sex cell, it can be transmitted by a parent to his or her children. We also have genetic engineering, which is manipulating or splicing genes for scientific purposes or medical purposes. For example, producing human insulin from modified bacteria. A genetic disorder is going to be a pathological condition that's caused by either an absent gene or a defective gene. And it's also known as a hereditary disease. For example, cystic fibrosis or Down syndrome, excuse me, or that Fragile X syndrome, hemophilia, muscular dystrophy, or phenylketonuria, also known as PKU. Tissue is the next step up, and this is a group or layer of similarly specialized cells that join together to perform certain specific functions. Histology is the microscopic study of the structure, composition, and function of tissues. So the histologist is going to be a specialist, and they do not have to be a physician, that studies the microscopic structure of tissues. There are four main types of tissue. We have epithelial, connective, muscle, and nerve tissue. Epithelial tissue forms a protective covering for all internal and external surfaces of the body, and they also form glands. Epithelium is specialized epithelial tissue that forms the epidermis of the skin and the surface layer of mucous membranes. Endothelium is also specialized epithelial tissue, and it lines the blood and lymph vessels, the body cavities, the glands, and the organs. Connective tissue will support and connect organs and other body tissues. Four kinds of connective tissue. We have dense connective tissue that form the joints and the framework of the body. Examples include bone and cartilage. We have adipose tissue, which is also known as fat, excuse me, and it provides a protective padding, insulation, and support. Loose connective tissue will hold organs in place, and it binds tissue together. Fluid connective tissue is blood and lymph, and this transports nutrients and waste products throughout the body. Muscle tissue contains cells within the specialized or with the specialized ability to contract and relax. Nerve tissue will contain cells with the specialized ability to react to stimuli and to conduct electrical impulses. When we're talking about the pathology of tissue formation, we look at, for example, the disorders of tissues that are frequently due to unknown causes and can occur before birth or appear later in life. We could be talking about incomplete tissue formation, such as aplasia and hypoplasia. Abnormal tissue formation, anaplasia, is going to be the change in the structure of cells and in their orientation to each other. And we contrast that with hypertrophy. Dysplasia is going to be abnormal development or growth of cells, or the presence of abnormal cells within a type of tissue. Hyperplasia, we have an increase in the number of cells in a tissue or organ, and we contrast that with hyperplasia, or contrast hyperplasia with hypertrophy. So hypertrophy is going to be the increase in the bulk of a body part or organ due to the increase in size, but not the number of cells in the tissue. For example, when we're talking hypertrophy, think of a person who does bodybuilding. They're increasing the size of those muscle cells, and those would be hypertrophy. So now we contrast hypertrophy with anaplasia and hyperplasia. The glands. Once again, these are groups of specialized epithelial cells that are capable of producing secretions. A secretion will be a substance that's produced by a gland. We have exocrine glands, which secrete chemical substances into ducts that lead either to other organs or out of the body. And we have endocrine glands, which produce hormones. They don't have ducts. The word root aden means gland. And examples of pathologies of glands, we have adenitis, which is going to be inflammation of a gland, adenocarcinoma, which is a malignant tumor that originates in the gland and may spread to other parts of the body. So we're talking adeno, we have that combining form. So we're talking a gland. When we're talking the carcin, that's going to be we're talking about cancer, and the oma is going to be that tumor. An adenoma is a benign tumor that starts in the epithelial tissue of a gland or a gland-like structure. Adenosis would be any disease or condition of a gland. And moving on to the organs. These are somewhat an independent part of the body, and they perform specific functions. For purposes of description, related tissues and organs are described as being organized into body systems with specialized functions, such as the skeletal system talks about bones, joints, and cartilage. The lymphatic system talks about lymphatic vessels, and lymph nodes. The immune system, we have the tonsils, the spleen, the thymus, the skin, and specialized blood cells. Special senses include the eyes and the ears. The integumentary system, we're talking about the skin, sebaceous glands, and sweat glands. Pathology, once again, this is going to be the study of disease, its nature and cause, as well as the produced changes in the structure and function. It can also mean a condition produced by a disease. A pathologist, remember we have the ist there, is going to be that person that specializes in the laboratory analysis of diseased tissue samples to confirm or establish a diagnosis, and this is usually a physician. Etiology is the study of the causes of the disease or abnormal conditions. We know that disease transmission, we have to have a pathogen, which is a disease-producing microorganism such as a virus, might also be a bacteria or a fungus. A communicable disease is going to be any condition that's transmitted from one person to another. We can transmit diseases by direct transmission, human-to-human contact, or the exchange of body fluids. Blood-borne transmission, being infected by blood that is infected or other body fluids. Those infected fluids have to enter the bloodstream to cause infection. For example, we're talking about HIV, the human immunodeficiency virus, hepatitis B, and most sexually transmitted diseases. Droplet transmission. We have infected respiratory droplets that can be transmitted by coughing or sneezing onto a nearby person. Using a face mask will limit transmission. Examples of this would include measles, colds, COVID-19, and influenza. Indirect contact transmission is going to be where the infected material or virus is on a has contaminated a surface, and now a person contacts that contaminated surface. This, for example, is why hand washing is so important. Let's say we have influenza, which is a respiratory disease, and we cough or we sneeze, and we have that droplet that has been coughed onto a surface, and it remains viable or alive for a period of time, and a person comes along and they touch it, and now they touch their mouth or their nose, they are transmitting that disease indirectly. So once again, frequent hand washing is essential to help prevent transmission of diseases. We have airborne transmission, which is contact with pathogens that are floating in the air. Microparticles remain airborne for a long period of time after someone coughs or sneezes, and they can travel up to 1 meter or farther and expose someone even after the infected person has left the room or the area. Examples of that would include tuberculosis, measles, COVID-19, and the chickenpox. Foodborne and waterborne transmission comes about by consuming contaminated food or water. This is also known as the fecal-oral transmission. Vector-borne transmission is transmitted through the bite of an insect and usually spread through blood-sucking vectors such as flies, mites, fleas, and ticks. Mosquitoes are the most common vectors, and they can transmit things like malaria and West Nile virus. So when we talk about outbreaks of diseases, we have the epidemiologist, who is a specialist that studies the outbreaks of diseases within a population group. Centers for Disease Control and Prevention, or the CDC, is a national protection agency, and they actually track outbreaks of diseases across the country and work to help prevent their spread. An endemic term means we have an ongoing presence of a disease within a population, a group, or an area. An example would be the common cold, which is always present within the general population. An epidemic is a sudden, widespread outbreak of a disease within a a specific population group or area. The pandemic is an outbreak of a disease occurring over a large geographic area, potentially worldwide. And examples of worldwide spread would be HIV and COVID-19. Types of diseases, we have organic disorders that produce symptoms which are detectable physical changes in the body. Examples include varicella or chickenpox, which is characterized by a rash that consists of hundreds of small blisters that are caused by a virus. We have a functional disorder, which produces physical symptoms for which there's no disease or organic cause identified. An example would be chronic fatigue syndrome. An iatrogenic illness is an unfavorable response due to a prescribed medical treatment, such as severe burns that result from radiation therapy, which is used to treat cancer, for example. An idiopathic disease is a disease without a known cause. An infectious disease is an illness that's caused by living pathogenic organisms, such as diseases caused by bacteria or viruses. A nosocomial infection, is also known as a hospital-acquired infection or an HAI. And a lot of times you'll find those terms are used interchangeably. It is a disease that is acquired in a hospital setting or a clinical setting and is frequently transmitted by the healthcare workers. An example would be multi-drug resistant Staphylococcus aureus or the MRSA infection. A syndrome is going to be a group of signs and symptoms that occur together as part of a specific disease process. And some conditions will include this term in their name, such as Down syndrome or fetal alcohol syndrome or metabolic syndrome, which is a common medical condition that's characterized by risk factors for developing heart disease, stroke, or type 2 diabetes. Factors that may include elevated blood pressure, central adiposity or that excessive fat in the abdomen, high insulin levels in the blood, and high cholesterol and triglyceride levels. Then we have congenital disorders, which are abnormal conditions that exist at the time of birth. Developmental disorders before birth are also known as birth defects. And this can be an anomaly or malformation. For example, we have the absence of a limb or the presence of an extra toe. Prenatal risk factors for those issues would be the mom's health. For example, she has a rubella infection early in her pregnancy. It could do with her behavior. For example, she consumes alcohol in amounts that lead to the fetal alcohol syndrome. Or what kind of prenatal care? For example, a premature delivery or low birth weight baby if she has minimal or no prenatal care. A premature birth is defined as a birth before the 37th week. And examples of issues that we see with prematurity, they have breathing difficulties and heart problems. Injuries during the birth process result from trauma during labor or delivery, and most of these injuries will include fractures of the clavicle, and they can heal very quickly. Aging is the normal progression of the life cycle that will eventually end in death. It doesn't matter what we do, we will all die at some point. During the latter portion of life, individuals will become increasingly at higher risk of developing health problems that are chronic or eventually fatal. Geriatrics or gerontology is going to be the study of medical problems and the care of older adults. Post-mortem means after death. A post-mortem examination is also known as an autopsy, and it is usually conducted to determine the cause of death. But it's also a way of evaluating the presence of disease and the effectiveness of treatment. Advanced directives are documents that are used to provide guidance for treatment of the types of treatment that a person may want in the case of an unknown future medical emergency where, excuse me, the patient is no longer able to voice what types of treatment they want. It can appoint someone who is authorized to make healthcare decisions if a person is no longer able to do so themselves. This healthcare proxy is also referred to as a durable power of attorney for healthcare, and once again appoints a trusted person to make treatment decisions in case that patient is no longer able to do so. A living will is also known as a physician's orders for life-sustaining treatment, or a POLST. It is a statement of wishes for end-of-life medical care, such as a do not resuscitate order or a DNR, also known as a no code or allow natural death, so an AND. It states that the person does not wish to receive cardiopulmonary resuscitation or CPR. To avoid errors or confusion, once again, always be cautious when using abbreviations. So to look for common abbreviations that are used in this type of medical terminology, look at Table 2.2 in the text.